Hi everybody, my name is Dr. Dan Kraus. I'm the owner and director of Bethesda Spine Posture. We do many things here. One of the main things that we do is help patients set up exercise programs at home. When we do that, durable medical equipment is a big part of that. I'm proud to say that we know how to use cervical dental rolls, thoracic dental rolls, and lumbar dental rolls. If you don't know what those are, basically these are traction units for the neck, mid-back, and low back that are utilized by chiropractic biophysics practitioners like myself. For advanced practice, we also can do scoliosis treatments in the low back and in the mid-back. Real changes can be made on x-ray when we use these devices that are prescribed specifically to the individual for individual specific distortions in posture. Very important stuff to learn to do at home, but we show you how to do it and how to do it safely so we can reliably get the best change possible measurable on x-ray. Chiropractic biophysics is basically exercise adjustment and traction done in the mirror image. So in the idea of exercise for home, pretty simple exercises that we use. A prolordotic neck exerciser to help pull a curve into the neck. And then also using something as simple as a massager for the base of the skull and the other cervical muscles and the trap muscles can really help to loosen up the muscular component, which then helps us with posture as well, and also helps to reduce pain. Also feels good. Patients really love it. Sometimes, as we go through the analysis to measure posture, we will find that people have a functional short leg. What does that mean? Well, it just means that there's a distortion in the pelvis that brings one side down more than the other. What we find is that when we put the right size full foot lift underneath the shoe, it will actually level off the pelvis in a way that we can show brings the spine more midline, thus taking pressure off the low back and supporting the pelvis in the proper way. We do that quite often in conjunction with custom-made sole support foot orthotics that help support the feet. I treat lots of feet pain, so we do manipulation of the feet, but once we've restored proper mechanics to the feet, I really think it's important to support those three arches of the feet, and sole supports is my go-to, although we use other types as well, but typically sole supports is the way for us to go. We do scoliosis treatments here. I am a ScoliBrace provider. This is a very advanced piece of equipment. It is specifically and individualized for the patient. It requires a great deal of evaluation, x-ray evaluation, iPad 3D scanner technology evaluation, and just plain old pictures, not to mention physical exam. We put all of those things together to create this specifically for the individual. We can make pretty amazing changes in scoliosis with certain patients. Very proud of this. It is a difficult, long process, but people that really follow through with it get pretty much amazing results. The other types of back braces that we use are something called a lumbosacral orthosis, or for short, an LSO. These devices are pretty amazing in the way that they're engineered now. They can be trimmed, they can be heated, they can be molded to the individual, so really help to be individualized for the patient and their specific needs, whether it's a distortion in posture we're trying to support, whether it's a repetitive stress we're trying to eliminate, or whether we're just supporting the spine in a way to keep the person from injuring themselves through their daily activities or work. One of the final things that I really encourage my patients to learn about are foam rollers and massage balls. If you have a little one like this, sort of like the size of a lacrosse ball, but has some density to it. A 5-incher, my favorite is the Orb. I think it's like $19 on Amazon. And then also a good size foam roller. If you have these three things, I could teach you about 1,000 ways to unlock your body. And we encourage our patients to have these, but we also have to teach you how to use them properly because you can injure yourself with this stuff. We are proud to offer any and all of this for the appropriate condition for the right patient. Come into Bethesda Spine Posture. Let us create a customized home exercise program for you. We'll get you set up with the proper durable medical equipment that you need so you can do it safely and effectively at home.